A 9-hour ER wait revealed something bigger than one bad day. My guests on this episode explain how they translate public health into plain language for friends and family who've never heard the term. We get into walkable neighborhoods and the invisible systems that shape when people get care. You're listening to the PHEC podcast, episode 471. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, an epidemiologist and entrepreneur who has spent over 2 decades working at the intersection of health, community, and meaningful change. I'm also the author of The Public Health Consultant, Expertise, Entrepreneurship, Greater Impact, publishing December 2026 with Johns Hopkins University Press. Through my consulting firm, Dr. C.H. Huntley, LLC, I partner with large nonprofit organizations, government agencies, and tribal nations on strategic planning and implementation, helping organizations turn health information into meaningful action in the communities they serve. A significant focus of our work right now is workforce development. And we approach it the same way that we approach all of our strategic planning work, by listening deeply, analyzing carefully, and building plans that are actually put into action. That same commitment to real, actionable public health work is what drives every conversation on this podcast, where public health professionals come to share their stories, their expertise, and their contributions. I'm so excited to introduce you to my guests and topic of conversation on this episode. How do you explain public health to someone who's never heard the term? That's the question, and it's the center of this panel conversation with Oluoma, a project manager focused on health information exchange in Maryland, and Savaiz, who is a lead patient service administrator in Illinois. Together, we talk through walkable neighborhoods, the invisible systems that shape a hospital visit, and the plain language habits that help this work make sense to friends, family, and policymakers alike. It's a conversation about connection, translation, and the small moments that build real understanding. Let's connect our conversation right now. All right. Well, I'm excited to have you all join me for this panel discussion. This is a great series that I've enjoyed having on the podcast. And I refer to it as What is Public Health series, because I have really enjoyed having these roundtable conversations where I bring a few people onto the podcast to really have that plain language kind of what is public health? How are we explaining public health to our friends, family, neighbors, people that aren't in the public health field? How do we explain it in ways that they can understand it and really maybe even see through our lens, whatever our specialty area is? I think this is important for a lot of reasons, but I think now more than ever, I've always been kind of on this soapbox about plain language public health, but now more than ever, if we get more community buy-in, if people really understand we're not so easily confused, dismantled, defunded, erased, and it's something that we can all of us as students, professionals of all levels, we can take part incorporating this language, this easier to understand language, and adding value so that people around us understand, better understand what we do and what public health really means. So before I go too far down that rabbit trail, let's back it up a little bit and start with some introductions. I would love for each of you to take a moment and introduce yourselves and tell us all a little bit about, who you are, what you do, what you're passionate about, whatever you'd like to share. So let's start with Oluoma.
Okay, well, thank you for having me, Dr. Huntley. My name is Oluoma Eze. I have about 8 years of experience spanning across federal health, public health systems, as well as healthcare organizations. My career actually started out supporting the health system environment with project management and operations, helping to strategically kind of create and develop programs at the hospital setting that help to better serve our patients. And then I transitioned into the federal health public health consulting space about 5.5 years ago. So helping to evaluate public health programs at the federal level, understanding what's working well, how we can better serve, our communities nationally as well as across different states. So that has really, expanded my focus on public health to be at that level. And currently, right now, I'm serving as a project manager for CRISP, which is Maryland's health HIE, so health information exchange, so helping data to be exchanged from health systems as well as CBOs to better have a holistic picture about a human being. Because I'm sure we all know, a person, when they present themselves to doctor's appointment or ER or to the healthcare system, what is impacting their health isn't always just health, like health related things, but there are social determinants of health and other factors that contribute to that person's health. So what we do, at CRISP is really providing a whole person lens to understand what is happening with this person, not just within the healthcare delivery context, but across their lives from a financial, from a food and security aspect, environmental health. So I'm really excited. This has been a new role that I'm stepping into, but I'm really excited to bridge my experiences in this space to kind of contribute to creating that whole person care type of provision of care for people and community. So excited to be here. Thank you for having me.
Oh, thank you for that introduction. That's really, really, I love your background, an opportunity to really impactful work. And can you tell me what kind of organization is CRISP? Is it a nonprofit organization? Is it a foundation?
It is a nonprofit organization, yes, but they partner with all types of organizations from health centers and FQHCs as well as health systems. So all types of healthcare delivery providers. But what I love about what they do too is that their services to community-based organizations who onboard to this health information exchange is free. So they're, really trying to remove the barriers that community organizations that's doing amazing, impactful work, but may not have the budget to pay for these type of services. It allows them to have access. So it's really trying to create this system across the state of Maryland, also other states, but I focus on the state of Maryland to really be able to exchange data on patients at their consent to be able to really provide the best level of care for them and also treat them outside of the healthcare system. So
Wonderful. Thank you. Oh, next we have Savaiz. Please introduce yourself and tell us a bit about what you do.
Good afternoon, everybody. Thank you, Dr. Huntley, for having me here. It's an honor to be here again amongst you all. My name is Savaiz Siddiqui. I'm working as a lead patient service administrator at Endeavor Health, located here in Skokie, Illinois, just about 25 minutes from downtown Chicago. I just recently graduated from Loyola University Chicago, completing my MHA degree. A great experience, met a lot of great people who've had such a huge impact on what public health really means to me. So I'm excited to relay that information with you guys here today in this conversation. On a day-to-day basis, my role consists of overlooking various specialty departments that could be general surgery, GI, neurology, urogynecology, etc. And I float between various hospitals depending on the need and I look over staffing, scheduling, insurance coordination, and stuff in that realm as well. Yeah, looking forward to this conversation with you all, and thank you again for having me.
Yeah, that's wonderful. Thank you for that introduction as well. I'm getting really excited about the conversation, given both of your backgrounds. Really, we often talk about public health as if it's its own little bubble of, existence, but public health really overlaps so many areas and so many industries. And both of you are in positions, I want to think almost like a bridge. You're connecting multiple industries together, all with this effort and this intention of advancing health, right? I really appreciate you both being here and, the perspectives that you bring to the conversation. So my question for both of you is, just how are you explaining public health when it comes up in conversation? And you can give me, you can pick an example if you want to talk about with your friends or colleagues or family members, neighbors. But I think just kind of talking about how you explain public health through the lens of what you do would be very helpful. It's always helpful for us to have the conversation in real time. And then I think about, listeners of the podcast, it's great to hear that because although we know that we, the goal is to have these more relatable conversations, I think it still feels very awkward for people, especially at a transition point of coming from, the classroom into applied, real work, early career professionals. And then I think another challenging place is for those that have worked in silos for years and years and years, and they get caught up in the jargon with their, core group of people that understand, they understand each other, and they think they're, being clear, and they're just not. And I get caught up a lot. I get challenged, and I'm not just talking about other people like I don't get it. Like, I get challenged. I would get challenged by family members. For a long time, I just would not even try to explain public health too much because it was just difficult, especially epidemiology. I love to say the word,
Right.
but really trying to explain that was always a challenge. So I really started working through that with my family. My goal was to make sure that my family members understood what the work that I was doing, understood public health. And now I'm really proud because, my older sisters, they do get it, and they are, they'll bring up, they'll make the right recommendations. They even listen to the podcast sometimes, and they don't do no health focused work. That's not their area. So it's been, an ongoing challenge, and sometimes it lands well when I do it, and sometimes it does not. But I think it's important that we are really making that effort to have these relatable conversations. So, Alana, we'll start with you. How are you explaining public health to, family, friends, or people that are not doing this work, and plain language in a way that they can understand?
Absolutely. And I love how you introed that because a lot of people in my family and friend circle, I do have friends who are in the healthcare, public health space, but a lot of them are not. So it is something that does come up like, so what is it that you do? And I found myself getting better at explaining it to your point as well, when you're like, okay, there has to be a better way I can explain this. So as I was reflecting on this, I guess in the simplest terms, public health is, for me, creating environments for people to experience and actualize the best in terms of their health. And it often, the way somebody had said it to me in the past was like improving and enhancing the environments where people live, work, and play. I think that's like a common term and methodology to speak about it. And also worship has been another aspect. So engaging where people are in their lives, where they live, and making sure that the environments in which they live in are optimal for them to be able to experience like the best healthcare for them and their families and their loved ones. So when I think about public health, examples of that could be, having just awareness of like what is going on in your community, like having safe, clean drinking water, like at the highest level, understanding, disease patterns before it hits, right? Before there's outbreaks, like that is a form of public health. Being able to have a safe place for kids to play, being able to live in a neighborhood or an area that is walkable. Even, me and my family, we bought a house a couple of years ago, and in the search, one of the things that we didn't realize, but now we're very grateful for, is there was a house we were very interested in, but it did not have sidewalks, like safe sidewalks that you can walk on. I didn't really think about it. I noticed it, but I was like, oh, I like the house. This is why we're, here. But now that we are living in a neighborhood that is super walkable, I just think about how nice it is to be able to just go for a walk on my breaks and be able to get that in. But if I live in a place that is not safe to walk, it's near very busy streets, or for my kids not to play outside, there's not a safe place. Their ability to play outside, my ability to walk and get exercise, which contributes to my health, can it be impeded on. So I think of it, that's a way that helps me to really break it down for people, is creating those environments. And there's obviously levels of intervention and levels of where public health comes to play. But those are some examples that I try to give people to kind of think about, oh, it's actually everywhere. Everything to me is public health. Like everything connects. And I love that this conversation we have, our backgrounds really span, the whole spectrum of how we can intervene and support people and communities, because it really is, there's opportunities to support the public health system across like the whole spectrum. So that's how I would say it in the simplest terms, allowing people to create conditions where people can stay healthy in their own environments and where they live.
I really love that. I think especially with you giving that example, like the walkable neighborhood and the sidewalks and explaining that, like I could see that being a very casual conversation, with the friend who can really now start to think and grasp, oh, I hadn't thought about that before, but I'll bet you the next time they're out walking, that may pop in their mind, right?
Yeah.
And then that leads to more conversation because then they'll start
Mhm.
thinking about, well, maybe this is public health and start seeing it, through a different lens. And then maybe that becomes a different part of like the next version of that conversation could go a step further, about, well, maybe why do some neighborhoods have sidewalks and some do not? And
Mhm.
so I really like that example and how that's very relatable. I love when we can interject a story and example like that because you could be walking with a neighbor and talking about that and that will stick in their mind, like that.
Mhm.
So if you have any thoughts about that, but then also the question for you, like how are you explaining public health to your family and friends?
Yeah, I'd like to give my thoughts first. I think that's a perfect segue into what I was going to how I would define public health. I love the idea of how you stated that it was a spectrum. That public health is it's broad in a sense, and it can be very confusing, let alone overwhelming to when explaining to, like Dr. Huntley said, friends and family around you. I know personally, my background for here at Loyola, I was primarily pre med. So I was studying for the MCAT. I was working the front lines, getting my clinical experiences in. So I bring that to where I am now, and I'm able to define public health in a different way,
Yeah.
through a different lens. So to me, public health it isn't just this abstract system. It's more or less personal, and it's personal to your background, to what you deem public health to be. I'd like to recall a story that properly attests to what public health means to me and why I feel it's such a vital field, especially now more than ever. A few years ago, my grandmother was hospitalized, and I watched her wait in the ER for more than 9 hours in pain before she was ever even seen by a practicing physician. And it wasn't because doctors didn't care, it was because that the system around them was entirely broken as a whole. So there were no clear triage processes, no coordination, no infrastructure to move for the patient from point A to point B efficiently. So to me, that's what public health means. It's in plain terms, it's this invisible structure that decides whether a person gets help in time or not. It's not just about the individual doctors or individual patients. It's about the system, the policies, and access points as a whole that stands in between a person and the care that they need and deserve. When somebody asks what public health is, my answer is public health is what happens before and after the doctor's visit. So
Mhm.
clean water, clean gloves, clean medical supplies. It's whether a clinic is actually reachable in communities that are underserved. It's whether insurance systems approve treatments in time. Prior authorizations are a huge factor now. It's whether a community has the resources to prevent certain illnesses from happening in the first place rather than us just treating it as we go after the fact. Yeah, so I feel like it's no secret right now that we're dealing with the rise of chronic diseases, workforce shortages across our healthcare systems, and stuff that I've seen in my current field where immediate cares, large organizations, and even private clinics are going through all of these things. At the same time, we're also seeing, healthcare costs climb and climb and climb with no near end in sight. So looking at the whole picture instead of just taking into account the next patient in the room is what public health means to me, how you treat towards the betterment of your community, large or small.
What a great example. And now that I understand a little bit about your background with health administration, it
Mhm.
makes perfect sense. I think if we were having this conversation even 10 years ago, I don't think it would have resonated with me as strongly as it does now because I really have a greater appreciation for the policy.
Absolutely.
That's so that, that layer of policy that's so important to public health. So everything that you're talking about, I like how you say it, it's like before, getting sick, before getting to the doctor and after, getting to
Mhm.
the doctor. So that almost invisible infrastructure and system, which is all based on policy. So policy is what drives the structure that's needed so that
Absolutely.
your grandmother's not sitting in the ER for 9 hours in pain,
Right. Right.
right? Great example. I really appreciate you highlighting that. Aloma, did you want to add anything to that?
No, Savas that so beautifully. I also that part really stuck out to me as well. It's before and after because I think a lot of times public health sometimes can be seen to be focused very much on the preventative side. Like we don't ever want to go to the hospital, but we need hospitals.
Right.
We need healthcare. We need surgeries. We need all of these different things. We need procedures and treatments, medicine. Like there's a place for all of these things. So I really appreciate how you said the before and the after, because I'm sure, Savaz, you've seen with people being discharged from the hospital and the issues that come with that when there's not coordinated care around them and just having access to whether it's education about how to take care of themselves or somebody to take care of them at the home. Like there's so many other things that contribute when we only focus on one part of a person's, care versus the entire journey and seeing everything about them and the cultural differences that they may need. So I really appreciated you highlighting that because that's a very important point.
I was also thinking about kind of you both kind of brought this to my mind, and we probably have some examples of our own, but you go to the doctor, go to a doctor's visit with a loved one, and they receive a new diagnosis. And
Mhm,
so there may be 15 minutes in that doctor's appointment, and they are going over some testing and results, and they're given some printouts of, you need to change your diet, a high fiber diet, and then follow up with this appointment. And they're going to have this test. So they leave out with these printouts with, instructions of what to do. And all
mhm,
of a sudden, after 15 minutes of getting all this detail, and then they're standing there with, okay, I've gotta do this. Okay, high fiber diet, we've heard that, but what does that so now what do I eat and what do I have to stop eating? And what did
mhm,
I do I understand what I just heard? And you're in the moment that the loved ones could be very overwhelmed, and they heard parts of this and parts of that, and they're trying to keep up with that next appointment and what prescription they need to fill and what foods to like all this stuff is very fresh. And then the structure, the system, the support that helps them really digest that. And some people have the ability to sit down with it, understand, have a higher, health literacy level of health literacy,
mhm,
and others will hear some parts of that and be very confused and be, remain in that overwhelming state. Like what support is in place after that appointment to help them get the things that they need. And so all of that is that whole system, all that structure is the public health part of that. But to your point, Alomo, it's both and. So we need healthcare and public
mhm.
health. Or if it's environmental health and public health, we need policy and public health. I think it is a very much, like I said, that overlap, but it's not just one or the other. It's both and.
Absolutely. And I think there's a balance for sure because to your point, I've been to appointments with my grandmother as well, and
Yeah.
so that really resonates with me as Savaz as well because she's had a fall in the past, and then I'm calling over the county trying to figure out, okay, what are the fall prevention programs and what things can we get in place? I work, my mom works. How can we get somebody to come to the house? Like and you even as a person in healthcare, I was so kind of taken back by how hard it was to just find support for her and it's everyone is trying to do like a good job. And even from a provider standpoint, it is overwhelming. I've had providers who will sit and talk with us longer, but then they don't take their lunches because they're trying to give every patient, the time that they deserve. And so then it's like they're overburdened as well because they're not meant to function at that level of overcapacity. So it's a bunch of different things that there's a place that each part of like the puzzle. We're all parts of the puzzle. And when we play our part to the capacity that we have, it's like it can really be a beautiful system, and support infrastructure that we provide as opposed to one side being more utilized or less utilized and or not utilized to its full capacity and things like that. So yeah, it definitely resonates with me in that regard too.
To add to that, what I see on a daily basis is like Aloma, you had just mentioned that it's overwhelming for both the provider as well as the patient. So I'm
Mhm.
seeing in real time how providers are going over the designated time slot to see their patients, and that causes kind of a backup for the
Mhm.
other patients that are to be seen right after. And this was a huge problem in a current clinic here where I work in Skokie. So this was a provider giving a patient a full stack of papers, calling it an after visit summary. Hey, this is what you need to do, outlined step by step. But then there's that, again, that educational reform where maybe the patients don't speak the same language, or maybe the patients are, this is the first time that they're seeing a doctor for this specific department, whether it's general surgery, neurology, or do these people have caretakers at home? Are they the ones that will be bringing them to future appointments? So these things can become overwhelming for provider as well as the patient. My current focus right now is like I'm so glad that we're here and we're talking about this. It's public policy. So my work right now for through Loyola University, the medical system, and educational reform. So how are we I work with the demographic of senior citizens over the ages of 65 and up who are being billed through Medicare Advantage plans. And I'm trying to create this workflow to try to inform this specific demographic, how they're being billed, what the next steps are, so that way they're not just getting piled on with these insurance bills and claims. And so I think it's a huge, huge part of our healthcare system that needs to be addressed.
Yeah. I think this is, I never know exactly where these conversations are going to go, which is part of the fascination of doing this series. But I think in this case, what I'm really hoping is that for you all individually, like especially, Savez, you have an opportunity to really kind of close the loop and really tie a bow on it, because now you've got the attention of key folks around you. I call them interest holders, right, around you. And they are understanding the importance of health policy. But I think you could go that next step to make sure that they see the public health part of this.
Mhm.
Not that it needs to have its own separate call out, but then it kind of does need to have
It
its own
does.
separate call out.
Yeah.
It needs to, because they get the gist of it. But I think if you go that next step and you're able to say, this is public health. This is why public health is important. This health policy piece, filling the gaps, addressing the gaps that you just described with this demographic, and labeling this is where the public health, the investment in public health, this is why we need that, because this is public health, and this is why we need the support, and we need
That's
that,
right.
So it could be as simple as people being able to almost have an aha moment, like, oh,
Mhm.
you know what I mean? Like they're getting it,
Absolutely.
but
Yeah.
not all the way to connect it to public health. And sometimes, those moments and those opportunities are kind of plentiful, but I think in terms of where we are in this really important election year, and healthcare is always a priority. Health is always a priority topic, but I think now more than ever, we have the ability to get others' attention to see and understand public health in a whole different way, and then that can lead to kind of what Alon and I were talking about earlier, that those next levels and waves of conversation. But if people who are making decisions about budget and policy and leadership, and our policymakers right now, like we're making decisions about who to vote for and who we want representing us, we need to make sure that they are understanding what public health is and where it fits into these scenarios, so that it gets proper funding and advocacy, as they take office and move along.
It's a great point. I truly believe that just the aha moment that we were talking about isn't enough anymore. We kind of need to instill further into what public health really does mean. It's not just this vague concept. There are specifics that go into public health and policy. And like you just said, and we're at a time where it's more crucial now than ever. Who we elect, who we're having represent us in all 50 states. It's important that we now are able to educate all around just the general population. Yeah, and with the world being more connected now more than ever, these health issues never actually stay in one place. We saw that just a few years ago with COVID-19.
Yes.
It's why this work, like I said, matters now more than it ever has before.
Absolutely. This has been such an incredibly intriguing and insightful conversation. I really appreciate you both. I want to be mindful of time. So we'll begin to wrap up. I'll give you an opportunity to share any final thoughts that you have, just anything you want to add to that just hadn't come up yet, or just kind of closing out. We'll start with you, Aloma, and then we'll move over to you, Chavez.
Yes, I would just say awareness. I think awareness is always the first step before any of us can do anything. And I think often the unsung heroes of healthcare and public health are the ones always carrying the flag and trying to pioneer. And I think because public health impacts everyone, whether you never go to the hospital because you are just healthy as anything and you just have no need of healthcare, or you go all the time or you have family members, I think it's a community responsibility of everyone. So I think that's something that I'm trying to instill in my community groups and, for all of us that are in public health and healthcare to really have that shared sense of responsibility and also having the awareness to connect the dots that this is public health, this is healthcare. You're interacting with it regardless of whether you know it or not. So I think really kind of having that and let that be like a nugget that I will leave people with, that everything is public health. And when things happen, you can almost always contribute it or source it back to something that was done or not done, services that are there or not there, access that was provided or not provided, that can connect to a lot of the other challenges that we may see in society as well. So I think awareness is the last thing that I'll kind of leave folks with, and seeing opportunities to engage even as an individual. And that's something I've been challenging myself too, is to be involved and engaged in my local community. I'm not a policy person, but I'm trying to get more into policy from a public health standpoint, but also other things, just being engaged with where I live, with where my family lives, because that also contributes to a lot of things that get passed and a lot of things that happen in my community. It is at that level. So I would encourage people to think about how they can get more engaged in their local communities.
That's wonderful. Savaiz, what about you?
I would love to, just keen in on that point of just inform. They're public policy, public health, they're both very broad spectrums like we just discussed today. So, any kind of relation you can have towards public health, I think we should hone in on that and kind of find what public health means to that person you're explaining it to individually. Personally, I got into this field because I saw what happened when a system fails somebody. And that was at a very young age. And my goal now is to make sure that fewer people have to go through that, that experience. And, how I plan on doing that in the future is try to build systems that actually work for the people that depend on those systems.
Wonderful. Thank you both. This has been amazing. I appreciate your time and your thoughts, and you're doing amazing work. So we'll definitely keep in touch. Keep doing what you're doing. It's really such a delight to meet you both.
Thank you so much,
Thank you
Dr.
so much for
Huntley.
having us. Yep. It's been a pleasure.
Yes, it has.
I hope this episode leaves you thinking about how public health is everywhere, whether or not we name it that way. Oluoma and Savaiz reminded me that translating this field into plain language is how we build the awareness and support this work needs to survive. Their stories, from sidewalks to emergency rooms, show how personal and universal these systems really are. Wherever you sit in this field, your ability to explain it clearly is its own form of advocacy. Keep having these conversations and keep bringing others in. I encourage you to connect with Oluoma and Savaiz, and you can find the links to connect with them on the show notes page. The show notes page for this episode, which is episode 471, can be found at phecpodcast.com. Once you're there, just navigate to episode 471 to find the show notes. One more thing before we go. Remember that our podcast has an app and private community, which is independent of social media platforms. This is where you can engage with public health professionals around the world. In addition to becoming a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download the PHEC Podcast Community app in your mobile app store. It's available for both Apple and Android users. You can also visit phecpodcastcommunity.com to visit the community and join on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.